fellowship for ACIM. And how many are aware of the fellowship program of ACIM? So if we need some place to go get more training, the ACIM fellowship is an ideal way to do that. You know, so you're going to get a lot of evidence this weekend to help do it. But the idea is not to get overwhelmed by this. You know, it's even after 40 years, this stuff can overwhelm me. I mean, the rapid fire, all the things we can do with chemotherapy drugs. I want to try and stay away from them. But, you know, but it's nice to know, and it's nice to have that reserve. And ACIM has a fellowship. And so we have a think tank tonight, if you haven't heard, that we, you know, kind of 6 o'clock, come and listen to what we have to say in our think tank tonight. So I have a patient I'd like to introduce you to. She's 69 years old. Has been a patient of mine for many years. But she had an initial complaint when she came into me with premature atrial contractions, and we just treated with magnesium and CoQ10. You see all the functional medicine kind of things that we tend to do. 2009, she had diagnosis of adrenal fatigue, and her diet was modified to eliminate wheat, dairy, and sugar. And you'll find that when we do that, we have to reemphasize it and continue going back to that kind of a diet because our adrenals are under stress every day. I mean, one of the first things I tell my patients is turn off the news. I mean, this is an election year. This is crazy. I mean, in their lifetime, I've ever seen the insanity within the political system. And so they've got to turn off the TV because it's going to stress their adrenals. So we were going back. So then she had normal routine PAPs and pelvics over the years, 2012, 2013. Then she developed some postmenopausal bleeding and had a pelvic ultrasound, showed endometrial thickening. Her diagnosis was endometrial hyperplasia. So we treated her with natural progesterone on a cyclic basis monthly, and it controlled the vaginal bleeding, and she stayed on it for about a year. Then in 2014, she had another normal breast and pelvic, and everything looked good on her thermal, and she started having thermograms. How many of you switched your mammography patients to thermography? If you haven't, you need to. In February 15, she had a recurrence of vaginal spotting, and then we decided at that point this was maybe pathological, so we sent her to an OB-GYN for endometrial biopsy and came out with endometrial adenocarcinoma. So she went on and saw the specialist at our hospital, local hospital, and went to a complete hysterectomy, oophorectomy, along with regional lymph node dissection. So the pathological stuff that came out that she had a grade B1, stage 1B, grade 3 endometrial adenocarcinoma. The lymph nodes were all negative, with cytological washings at the time of surgery, was negative for cancer. But she was given adjuvant therapy, including radiation and chemotherapy, and the patient felt uncomfortable and declined both. So we ended up, she came to us and helped develop an integrated protocol in which we decided to include diet, nutrition, IVs. Along with my wife, who's as close to I am as being my twin soul, is we developed a program, the transformation program, which is looking at all things, diet, exercise, nutrition, your environment, and this is one of the things that we emphasize with all our patients, whether it's chronic illness or cancer, you've got to treat all of that. And, you know, with all the training we've had at ACIM, if you do not treat the emotional components, it's like treating cancer with one hand tied behind your back. So we looked at some of the studies. Some of the traditional studies, she had a C125, which was normal. The year before, she had one of the new colon sentry tests, which looks at the genetics of the stool, and she was a relative minus 6.3 for colon cancer. Her CBC, CNP, the traditional medicine laboratories and thyroids were normal, and she had a repeat the time of the year of her, and her glucose was up slightly. That's one of the big things. Sugar, sugar, sugar. Cancer is fed by sugar. We have got to control the sugar. If you don't do that, you're going to have a losing battle. If we don't control the sugar, we don't control the acidity, we're never going to win the battle for cancer. So this is an adjunct treatment. And as Lee said when he introduced himself, he said, I am a cardiologist, but I don't treat cancer. I'm not an oncologist. I'm Jim Lemare, family physician. I'm not an oncologist. I treat the whole body. My goal with every patient is to help them nutritionally fight whatever illness it is, whether it's cancer or heart disease or diabetes. So remember that we are not oncologists here. We are physicians who treat the whole person to improve the health of that body, to fight whatever it is. We are just overwhelmed That's one thing Dr. Gordon taught me. There are 90 new autoimmune diseases that we've seen in my 40 years. Autoimmune. We had problems with our body's own resistance. We don't treat the autoimmune, we're not going to get the patient healthy. No matter whether you're talking cancer, or you're talking heart disease, or you're talking rheumatoid arthritis, all of those are infected if you do not treat the autoimmune disorder. So what do we do? Heavy metals. We've looked at our heavy metals. Are really high aluminum, and we've been talking about that recently around our area. We've seen a lot of aluminum, and I think it seems something more and more. The aluminum byproducts. When you have fluoride in the water, we're just seeing more and more people with aluminum toxicity. She had G6PD, which if you're doing IV vitamin C, you know you have to check a G6PD because of the people of Mediterranean descent who cannot handle the higher doses IV. And we've done the Greek test. So she had a circulating tumor count initially of 6.4. It has come down, but then has slightly gone up a little bit. So this is an ongoing battle. So we're a year into this battle, and she continues to do well. I just put the surgical pathology here so we know that she is 0 out of 10 lymph nodes. She did a pelvic ultrasound which showed thickening of the endometrial, but had that year showed endometrial hyperplasia. And then after we did the final ultrasound before surgery, she had a large mass over that 2-year period. And then she had a pelvic CT, which consistent with endometrial cancer, but no metastatic lesions were seen. So after getting the initial diagnosis, she had the surgery, the pathologic specimen was removed, and was recommended to undergo chemotherapy and radiation, but did not feel comfortable with it. So with her family consulting, she declined the therapy, and we went into developing the program that you're going to see outlined, which we do with many of our patients. What does that include? This is hallmark of everything we do. It affects everything we treat with patients. It's everything we have to do. So what do? Diet. That's unique. Nutrition. The supplements we use. IV nutritional protocols. Key to everything we do. Like someone, is a cardiologist that has seen the light, and he's now doing outstanding cancer work. Is we can all work with cancer patients. And so then the emotional therapy. If nothing else, emotional freedom technique I learned from Joe Mercola, and we have recall healing that Peter Vanderwerf in our fellowship has taught us. So there are many, many things we do. If I tell my patients, as a family physician, I try and make things very simple. We're a three-legged stool, body, mind, and spirit. If we do not address the emotional component, we knock that out, that patient's never going to get up. They're never going to get up if they do not address the emotional components. And then we have some other therapeutic. We do biomats, far-infrared saunas, so we'll talk and see some of the things we do. What else we do? Detoxification. Detoxification, detoxify. If there's anything I learned from Dr. Gordon, is if you do not detoxify the body, you cannot have a healthy body. So as a family physician, or at whatever stage you are, if you do not detoxify that body, you cannot have a healthy body. So whether it's cardiology disease states, or if you have any chronic illness, you've got to detoxify. We use the biomat. We do foot detoxes. Far-infrared sauna. We have a Himalayan salt room. We'll be happy to talk to you about that afterwards. See my wife. It's excellent for detoxification. And then the EVOX. We use the Cyto EVOX machine for emotional release, and we've used that and incorporated as part of our things. What kind of basic nutritions we give her? Multivitamin. If the AMA even says now we should all have a multivitamin. Isn't that amazing? 10 years ago, it said we shouldn't take any vitamins because vitamins could kill us. Didn't that? Remember that? The AMA said vitamins are hazardous to our health. Now they say, yeah, you should have a multivitamin. So at least the AMA has swung over to our side. Vitamin D3. Can't emphasize it enough. We live on the Sunshine State. I gave up shoveling snow in Holland, Michigan, and decided to move to Florida because I was tired of shoveling snow. And in the Sunshine State. And up to 70% of the patients I see in the Lumiere Clinic are vitamin D deficient. Why is that? Because we're so cancer-phobic, we cover up. And we live in air conditioning. When I lived in Michigan, you stayed outside. We didn't have a lot of air conditioning. But still, you've got to have vitamin D3. Omega-3. My mother told me, eat your fish, Jimmy. It's brain food. How many of your mothers... Our mother's advice is still good to us today. Magnesium. CoQ10. CoQ10 is important for every cell of our body. And so no matter what stress you're going through, you've got to have enough CoQ10. We can actually measure those levels, so we can be very scientific. Vitamin C, we've given it both orally and IV up to 100,000 milligrams, but you can go even higher if the patient requires it. Enzyme balance is enzymes. And, you know, when you think about Nicholas Gonzalez, one of the things that was a hallmark of his was, you know, taking enzymes on an empty stomach to digest a cancer. And always Dr. Gordon has taught me, you know, Wobenzyme 10 to 20, 2-3 times a day on an empty stomach to clean the cancer out. And then probiotic is our macron probiotic is our probiotic problem. And so she's been taking the probiotics. And so what do? We start out, and my wife, as she puts people through our transformation program, this is the first thing she does. Get a food journal. You can't trust what people tell you they're eating. How many of you heard patients come in and say, "Oh, doc, I'm really having a good diet. I'm a clean diet. I eat well." Right? Well, when you tell them, you got to get rid of the wheat and the sugar and the corn and now the oatmeal and, you know, artificial sweeteners. By the time you go through all that, their heads are hanging down and they kind of say, "You got me." Haven't had an experience? Have them write it down. Do a food log. You know what you're dealing with. I married a woman that's much smarter than I am. She's got 6 degrees and she's now a certified nutritionist. So I am fortunate that we have a synergistic relationship in our marriage and in our practice. And I can send them. And when she's talking to a patient, that patient says, "I'm doing this," and their body's screaming. You look at the tissue and it's all edematous. It's inflamed. They're eating something they're allergic to. Don't forget that piece of intuition we all have. I think Tom Lucky in the corner, one of the best intuitive physicians I know. Intuition is a key part of what we do. Don't ever lose that. And you know, as an allopathic medicine, you've got to have a standard, and you've got to know how many units of this and how many units of that. Don't lose the intuition. That's one of the great things of being an integrated physician, is a key part of what we do on a day-to-day basis. Okay, how many have asked this question? Where do you get your protein? And I just say, where do cows get their protein? Right? From the grass. And no, you can't do corn-fed cows. So, that's where we start. So when we begin this journey, it begins with nutrition. We are what we eat. And as Dr. Gordon says, not only what we are, what we eat, but what we assimilate and what we don't get, you know, rid of if we're not doing it. It's all part of that. You know, is the gut. I just last week and was we taught at a clinic in Tampa, and my topic was the microbiome. Buzzword of the day. Anybody not know what the microbiome is? You know, this physical body of mine has 10 trillion cells. But my microbiome has 100 trillion cells, that internal milieu. And if you are not in balance with that internal milieu, you're not going to be healthy. So look at some of the top 10 servings of vegetable protein. Much more than across the bottom. It's more than meat in some of these cases, so that we use high protein food. We need to know control carbs. We have to lower the A1C. You know, we've been given a range of topics of 4.8 to 5.6 is normal A1C. But the problem is that's not a cutoff. It's not an absolute cutoff. You get to 5.5, you're still in trouble. Dr. Dave Perlmutter is a good friend, and he wrote Brain Brain. And what he said is when you start getting up beyond the ideal, you're getting 5, 10, 15, 100 times more increased risk of diabetic damage, even when you're in the normal range. So we can't allow normals. That's one of the things as integrated physicians, we look for the ideal or the optimal. Okay? So these are just questions we need to do to get an idea from our patients, as we did with our patient, how much calories? How many know that standard American breakfast for a lot of people? Can you believe all the things that we go with this here? We wonder why we have a rising rate of autoimmune diseases and cancer. Because this has become a standard American breakfast. So we've heard the ketogenic diet. How many use the ketogenic? We all need to know the ketogenic diet. We like it is because my wife is a nutrition expert. She takes them off the milk and the dairy, and she looks at the sugar and she modifies it. But you have to have a low carbs. Now, this is what we encourage our patient and all of your patients to do. If there's not a color in your diet full of colors, you're missing the boat. We're all treating patients in the real world. This is what their diet must look like. We can't accept, I'm too busy, I'm going to go run through McDonald's and I won't eat the bun. Okay, that doesn't make a heck of a lot of sense. So we've got to do something different. Okay, how many of you start the day alkalinizing your body? Warm water with a lemon is the first thing in the morning. How we start life with the Mayor household. We get up, we do our Tai Chi, Qigong, we do our meditation, we get our lemon water, and then we go feed the horses and the donkeys, and then we're off to work. I know you all don't have those horses and donkeys, but, they're basically lawn ornaments, but the love you get from having pets. That there was a study that children that have pets have less immune disorders. Having childhood pets. Isn't that important? So I feel blessed that I married a woman who had animals and a farm. I'm healthier now than I ever been. And you can talk to Dr. Cowden and Dr. Gordon. That's true. We didn't bring our before and after pictures. My wife and I have them when we do a meet the doctor on our first Monday of every month, and we bring our patients in. And they see if you're not leading the lifestyle you're preaching. What do you think that tells our patients? So 10 years ago, when I was 40-some-odd pounds heavier, when I was an Olympic triathlete, I was a sports medicine Olympic physician. I knew it all, right? We know it all. But if you don't live it, don't expect your patients to buy into what you're doing. So, and that's what we do with all of our patients. We own Himalayan Salt Room, the benefits of balancing the ideal forms of salt. So it has to begin with little steps. If we sometimes, people feel like they can get overbalanced. When we look at where we started with the standard American typical Western diet, do you know that when they analyzed the standard American diet over 10 years, we gained 10 pounds and they increased the mortality of the American population? It doesn't work. So then you begin to do carbohydrate. You're getting baby steps. And then you finally get them down. Look at the difference, what a ketogenic, adaptogenic diet is. Got to get down there, and that's what we've done with our cancer patients. So if you stop eating when you're no longer hungry, you stop when you're 80% full. But there's still some slight sensation of hungry, and you've got to have a form of natural fiber. Okay? We put them on natural fiber. We've got to cleanse the gut. It has to pull out those toxins. Water. What kind of water? Why drink water? Well, you can see all the benefits. So I'm preaching to the choir, but I wanted you to understand, as you're approaching your cancer patients, these are the things that they have to live with every day. And if you're not doing them, you've got to encourage them to do that. Why they drink healthy water? One of the things my wife has taught me is food combining. As a family physician, I took athletes that were world-class champions, gold medalists in '92 in Barcelona. And they were excellent with their diet. When you think of a couple Olympics ago, Michael Phelps was eating 12,000 calories a day. Now, he was burning off a lot, but there's more than that you have to be able to proper combining. So here's a food combination chart you can refer back to. Is you've got to do proper food combining, particularly with your cancer patients. You can't have things sludging in your gut and creating a toxic mess if you're not properly food combining. Now, my beloved wife developed our Lemire food pyramid. And you see, it's totally flip-flopped from the standard American pyramids. I know Joe Mercola has a very similar kind of food pyramid. And you see that, at the top is the meats, and it, again, emphasizes to our patients, and our patients are living this. We emphasize it. to them day in and day out. Colon cleansing. If you do not have a healthy colon, you cannot expect yourself to be healthy. And so these are just some ways of cloning: flaxseed, spirulina, chickweed. Now, all of these are great things to clean out our colon, and this is what our cancer patients have to do. They've got to get rid of the toxins. Foods that cleanse the liver. And again, I know I'm preaching to the choir, but we're demonstrating that we have a cancer patient, and this is what we do. This is what you have to emphasize to them. Is it begins with our individual and what we put in the gut, how we change the microbiome from bad to good. And these are all key parts of getting our liver cleansed. Now, the emotional. Stress and the emotional cycle. We study Chinese medicine with a Taoist priest, and it's one of the most important things that we do is you have to address the emotional liver. And so when people are angry, and we're doing emotional testing, and their anger, you're not going to clean up the liver and the emotional, because that inflames the heart. And so you can see it becomes a vicious cycle, how all of the kidney events. Or if you're down here and people are fearful, and you're having kidney failure, what are they afraid of in their life? What is their fear? Fear of death, fear of dying, fear of abandon. We have so many single mothers who are coming in. And now in Florida, I'm getting grandparents raising second and third generation of families. I can't tell you how much stress that is for families. The stress that our children put on us. So again, we do emotional freedom technique. We do recall healing through the academy. And we do the EVOX, which is the Zyto form of emotional healing. And you heard this morning that psychologist said 2 years of an hour a week, he did it an hour on the EVOX, the emotional release. There are ways to do it. That's why I encourage you to look at the Academy Fellowship. How many of you look in your patient's mouth? We're talking about cancer patients. How many look in your patient's mouth? First thing you should do, open your mouth. It is amazing why we fail to do that. As physicians, we were taught they're there to chew. But now if you look at the organs that are tied to the earth, to the individual tooth, and it's interesting, Dietrich Klinhoff taught me, you get somebody with backache, but you've got a tooth on that back meridian, you inject them a little Procaine in that tooth, and the back pain goes away. How many have ever done that? Yeah. It's amazing. These nerves are related. So when you see cancer patients, you see how proclivity of all of this that it interacts it. And when we deal with an individual patient, we look in their mouths. So here's our plan that we do for health and longevity. Reconnect with the master within. You see, it takes time to nurture yourself. And that's one of our daily things is the meditation, Tai Chi, Qigong. We have to get that spiritual thing going. And that's generally true for our cancer patients. But they have to do that. We do an exercise program. We used to say as physicians to the athletes, use it or lose it. And that's true. Even at 90-year-old patients, if you put them in a wheelchair and use light weights and you increase your muscle strength, you decrease the risk of falls and breaking bones by just adding a little weight training. Age is not important. Fine-tune the nutritional programs. And when we talk to patients, we continually fine-tune this because our knowledge changes as we get about. And then service to others. Is one of the special things in my life is that I'm now at a point in my life, and I'm in the afternoon of my life. How many of you here in the afternoon? I see a lot of gray hair, so I know that you are. So I don't have to see the ray of hand. And what I've done is I do some things. I give back to the country, give back to our county, and I see homeless twice a month. Giving back to. And if you're working with cancer patients or patients with chronic illness, they need to be able to be of service to others. Volunteer at the hospital, volunteer at the dog shelter. They have to do that. You have to incorporate that into your program so that you know what they're getting into. And celebrate. We have forgotten to celebrate life, to take the time to smile, be happy. If you do not do that, we've lost the art of celebration. And as that is, we've forgotten how to celebrate life. And it's unfortunate. You know, here we are with a room full of healthcare providers talking about how to help cancer patients. But the problem is when you hear a cancer patient at some point saying, "Doctor, the cancer was the most important thing in my life to get me to realize that I need to do this or change that," that they found that the cancer was something they could celebrate. You know, it's not just something that we have to downcast and we're going to carry this to our deathbed. No. That's one of the things that I see with traditional medicine. And we're dealing with a gentleman who I sent to an oncologist. And first thing she said after she did all the studies was, you know, get your life in order, and, you know, here's hospice, and, you know, you're too sick to do anything. Well, we started, you know, some vitamin B nutritionals and some ozone, and if nothing else, when I say celebrate life, is never take away that patient's hope. We should all be celebrating the hope that we all know. You know, is if you look around the cumulative experience in this room, we look at celebrating the cancer survivors from stage 4 cancers. We all have them. There's people there. We should be able to celebrate that and never, never take the hope away from our cancer survivors, anybody with cancer. And that goes along for any chronic illnesses. So I wanted to show you one last thing. Dr. Cornelia will be here this afternoon, and this is her body of work. Because when you think, what else can I do? Dr. Cornelia has given us an idea: mind, body, and soul. Okay, focus, concentration, destination management, biofeedback, meditation, hope, optimism. We just talked about that. Freedom from regret, life satisfaction. You know, is how many times you want to look at patients and look back and say, you know, no matter what, my life has been satisfactory. And, you know, there became toils and traumas and things that, you know, we have within our life that happen, but it happens for a reason. We all came and we all have a contract, and we're going to live this life, and we can make the best of it or we can make the worst of it. And our goal is to lift those patients up. And then I put in, and you've heard many of these cancer treatments that are here, to think of alternatives. I don't do IPT, but I have a doctor across south of me that I can send somebody to for IPT. So you may not do that. I'm a family physician, and I see the gamut of family physicians. And it's very interesting, is that I'm in the sundown of my career, and I'm seeing more children than I've ever done that. Because why? This alternative method is striking home to young families who are being told, you know, that you have to have a newborn that's got to have 8 immunizations. You know, I could spend all afternoon talking about that one. I mean, how we are abusing the young of this country. You know, when we talk about taking in studies and drug studies, and then we see the elderly, because that's where I'm treating most of them, but we're abusing the young. That we're giving young infants, we're giving hepatitis B, sexually transmitted disease, to a baby in the first year of life, who's in the first day of life, I should say. Something that it may never get. Why? Because that's become policy. Why? Because it's driven by the drugs industry, who's got they've got a free pass after 9/11, that you can't sue them individually. You have to go and cooperatively do that. And so when we look at our range of motions, when a cancer patient comes to you, we have to give them options. And here you see there are options for you. And that's what's most important, is we have the options. So I'm going to summarize, and then we can take a few minutes for questions. Is this case study shows a functional family physician, that's myself, supporting a patient on her journey. That's all it is when you see a patient, whether it be a cancer patient or a mother with a newborn who's so fearful of those things, you want to support that mother on her journey. And that's what I strive to do. And I'm seeing more children than I have ever in the last 10 years. And I live in sunny Florida, the retirement capital of the world. And I'm seeing children. My wife always has to sneak in the room and see how that little cute baby is because she loves children, and we have grandchildren. And think of what we're doing. The treatments we're doing for our cancer patient today is giving them a loved one and increasing the surviving time of their loved one. And so what we're trying to do is to help them lead a healthier, fuller life and enjoy what they want and to be able to celebrate. So this is an approach that any primary care physician can adapt to learning how to deal with chronic illness. Every one of us should be able to do this. And lastly, I encourage you to seek more from ACIM, particularly the fellowship training program, because I think that it offers the opportunity to get more intense training in the fellowship program, and all the things we're talking today. You can apply this to any chronic illness. I know Dr. Yu is going to talk later. I mean, it applies to everything. All the things I've learned in him from parasites goes throughout mine. Learning muscle testing and being able to pick up parasites, before you can even test for them. And then learning that parasites go through life cycles, just like we do. And so if you're not treating them through several life cycles and keep up till you get rid of them, you learn that from people like Dr. Yu. And so that's what I think the ACIM fellowship will offer to all of us here, is that opportunity. Well, thank you. I've enjoyed this.
Thank you so much, Dr. Lemire.